using Rocktape, which has a font to it, and that helps us understand how much stretch we're putting. We take the tape off the paper. We start on the outside of the ankle, underneath the ankle bone, and we put it on with no tension. And as we stretch, the font gets larger. The more we stretch, the larger the font. We position him in inversion, applying tension, and then we come across and go above the ankle joint, the ankle bone. And at the end, this is a little bit too long, so I'm going to cut it. At the end, we once again put no pressure, and so the font should be normal. So we can see how much tension we're applying. And in the front of the foot, we take a shorter piece. We started around the fourth toe, right about at the level of the bunionette and the bunion. We don't want to encircle the foot. We don't want to form a bracelet because that will cause swelling or cut off circulation. And so we stretch. We move towards the middle of the foot. We keep the stretch. We push up on the 5th metatarsal, down on the 1st metatarsal. If the patient is doing it, they're sitting in a chair and going like this, and that's how they put it on. So I'm forcing, I'm coming underneath, continuing the stretch. I don't encircle the foot, and again, this is too long, so cut it over here. And I end it with no tension, so we have normal font, and here's the stretch. And now I'm going to have the patient stand up. Let's stand up on here. So you remember what his foot looked like before.
Mm-hmm. No, they are.
See how much better it is?
Mm-hmm.
So you can see the difference. This was his worst foot, was much more collapsed, and now it's obviously, it's more narrow, it's shorter, it's more arched, it's doing everything right, and so that would be the taping.